Good evening. This is Dr. Bill Wyatt again with the American Orthodontic Society. And a lot of people have wanted to know what method of doing orthodontics that I used. And it's a very simple method, but you can do anything you want to with it. I mean, you can make the teeth do just almost anything in doing it. So I'm going to run through maybe 2 or 3 videos here and try to show you the method that I use in doing orthodontics, and we call it straight wise. It's not straight wire, it's just straight wise. Just a little smarter way of doing orthodontics. Just changed it a little bit. Instead of straight wire, we call it straight wise method of doing orthodontics. So let's get started on it. It's pretty late in the afternoon or the night, and I want to cover this as much as we can, and I'll probably have 2 or 3 videos on it. Now, we have been using a little single bracket. It's just the smallest little bracket you can get hold of, and it fits right. You just got to put it right in the center of the tooth. I mean, it's right in the center. And so if you are hard to pick the center, you can draw on there, but then you got to get rid of the lines and everything. So I just stick them right there, and then you can manipulate them with the back of an Explorer. So we'll show you how later. The brackets are just single. Let me kind of wipe that out for a minute. And the bracket itself is just, well, it's got a groove in it like that, and come up, and then there's a base that you bond onto the tooth. Now this bracket is what we call an 018 bracket slot, or this dimension from the top to the bottom is 18 thousandths. Now from the side of the bracket, going from one side to the other, it's 17.25. It's like we use a arch wire that's 17 instead of 18, so it gives us a little slack in between here, and this is 2.5 or 25 thousandths. So we call it an 18.25 bracket, and that's a much smaller wire than the people who use an 0.22 bracket, or that's 22 thousandths compared to 18 thousandths, which is considered, in other words, is 4 thousandths smaller than the 0.22 bracket. And that makes a lot of difference to me. You can torque better and do a lot of things better in a smaller wire. And I don't even use a wire nearly all the time. We just finish the cases in a 17.25 wire. In other words, this dimension here is, the bracket is 018, where we have a 17 thousandths wire that fits in there, so we got a thousandths of slop or a movement that wire works in there. Now you lose 4 degrees by every 1,000th that you have in here. That's smaller than that, you'll lose 4 degrees. movement in there. So if you put torque in the arch wire, you put a wire in there like this, and say it's got 8 degrees torque, and it's a 17.25 wire, then you would have 4 thousandths gap in there. This gets kind of complicated, but just you get to do it, and you don't even think about all this stuff right here. You just put the wire in there and know that you got a little slop in there. And so if you want 10 degrees torque in this tooth, you want it like such and like this, and you have your bracket come out and come down and something like that. And your brackets already have a certain amount of torque in them here, and you want 10 degrees in there, and you may not can get it with the torque that's in the bracket, so you add additional torque to the arch wire when you build it, so that the wire is a little like that. Now we catch the wire with a pair of pliers and flatten it out, and now you've got it just plain flat, and you stick it into this bracket right here. Now when you turn this loose, the wire has this amount of torque. It's going to, see if this is lined up on a tooth now, it's not much of a tooth. Say this tooth would be going up this way. This will make this root go in this direction, rotating at this point right here. In other words, this bend this wire is trying to get back. It's trying to go back like that, so it pushes on the top corner of this and the bottom corner next to the tooth, and it'll tend to rotate that tooth right around this point right here. So it'll add to the torque of that tooth. Now that's, people get confused with this. A lot of people that are doing orthodontics a lot, but you can actually make the tooth do anything reasonable that you can think of in here. You can just take them, make them go up and down and around and different things. So let me erase that now, and we'll go back to this bracket that we stick on this tooth. Now when we bracket a case, you don't start out with it looking like this, This is after you finish this whole thing. Now these little brackets, if you want to buy them, you can buy them, you can get them wherever. And a bracket to me is just a bracket. It's something that gets a hold of the tooth, and I can put a bend in the arch wire that makes the bracket do that, and the bracket is bonded to the tooth, so the tooth tends to do that. And sometimes it takes a while to do that. So you can torque the tooth and make it go this way, and you can angle it at the same time, and you can lower it or you can raise it, and you can just do anything you want to. You can rotate the tooth. We'll show you any movement you want to do. You can do it with the tooth. And then you've got brackets on the teeth, so you don't have any space between the teeth. Now, people ask me about bands. Are bands better than things? Bands are a lot stronger, so I use them on the molar teeth. Upper and lower molar teeth, we use bands. And they'll have a lingual attachment, and then we have these attachments on the side of the band right here. We'll get into that a little later in more depth. But we do not have this double layer. You got a layer of band on both sides and a layer of cement between the bands. And when you take that off, you've got this space between every tooth in here. So you have to close that space. And if you close space up on the thing, you do this to it. And so you take away part of the torque. So if you're trying to really do something exactly like somebody wants it, don't use bands. That's the wrong thing. I don't think anybody out there is doing that now at all. But use the bracket, and then that leaves space. Now, granted, I have some space on the upper molars, but I pull that forward when I put a retainer in and close that space up back in the back of the mouth. But nothing from the molar to the molar on the other side will finish it with the teeth right jam up against one another like this. And that put them exactly where you want. Then you call the parent in if this is a child, or if this is an adult, give them a mirror and say, is this what you want? Because this is going to be what you get when we take these brackets off. And so we can take them off, part of them, but we can just take the whole upper arch off, and build a retainer that holds those teeth in that position until they have really had time for the bone structure to set, in a sense, like that. So let's get on and show you a little more about these brackets. This is just looking at it from the front, and I'm going to look at it from the side now. In every arch wire we bend in the office. Now, ladies, you have to have people working for you that are competent and know how to do this. And it's amazing what some ladies can do and how they can learn how to bend these wires. And they can make them out there, and you put them in, everything, and they can put these omegas in the wire. This is an omega right here, kind of like that, and the wire goes through this tube up here, and we tie this wire back. In other words, that wire can be in there just tight. You can't hardly get anything between the teeth when you tie that back. So you don't need the little wire that goes like this, fold. You can actually use them if you want to, but that you can leave these wires on and it would stay that way. But we don't even need that wire, see, unless it's some rare occasion. We can tie this kind of passive on one side, and you use an instrument that's got a kind of a steel like this on it, and you reach it, put it down in here and push on it, and then you've got the wire with the pair of pliers. You pull it real tight, and then you wind that wire down and tuck the wound part where it can't get out and poke the person in the gum tissue. Now I'm going to erase that, and you can see where we've got the little twist right in here, and we put that instrument on here like such, and you push on it. Now the one side, now you go around, you got on the other side, you've got the same thing going over there. See, that's going back into the tube. So you tie one of them where you want it, and now you push and tighten the other. It's no need to just tighten one side. It goes all the way around and comes back over to here. And you can like you can have a little gap in between two teeth here, and you can tighten this one side over here. If you want to tighten it up over here where the gap is, you can blanch the tissue right in here, and it will pull those teeth together, and you don't have to worry about friction of the bracket. The only friction ever, somebody bites one of these and clamps it together with a lot of force, then the wire is stuck there and it can't move. So what you know it's stuck, you just we get a set of little screwdrivers, and we just put a screwdriver into that hole and go up and down with it a little bit, and it'll restore the width of that bracket slot with a slight tiny screwdriver like that. So let's go on here a little further. So both of these arches, you see, we put omegas in just nearly everything we put in to finish something with it. We can tie this back. Now I can pull it and tie it there, or I can put the tie back wire all the way here and come up underneath this one and twist it down right here, and these two teeth will be tied together like mad, and then you tighten the other one around on the other side of the mouth, or you can pull it together and you can squeeze the teeth together, and that's one of the nice things about closing it up. And when you finish the case, you take this arch wire out and we leave the brackets on, and we take an impression of the teeth with the brackets on there and this band on there. And so when we make the retainer, most of the time we don't need a band on this tooth right here, but we do down here virtually all the time. You band the second molar, and if you've got wisdom teeth coming in, you may have like if we extract a bicuspid in here and close this up and bring this forward some, frequently we save the wisdom tooth back in the back. So if somebody loses a 6-year molar, we can slide the second molar up into this space and fill it up, and the wisdom tooth follows behind, and we can line it up in here, and when you get through with it, you can take it to 10 dentists, and I doubt if one of them would recognize that this is a second molar right here and this is a wisdom tooth right there. They might, but you can slide that tooth like that. Now, somebody asked me today, I read one of the replies from some of the people, and we want you to write back and tell us what you need. I have no earthly idea who I'm talking to, but I have gotten letters from places like Cambodia and even in the Himalaya mountains. Somebody writes back from places that you never heard of, and wants to know how to do or what to do or why I do certain things like that, and I try to give you the best answer that I know of, and some of them possibly won't be right, but there won't be very many, because we've checked nearly everything we've done. We've done it many times and it works, and I'm not trying to sell it to anybody. I'm just telling you what I do, and if you want to use it, you go ahead and use it. Okay, let's we get that off my chest here, and we'll go ahead and see. Now, we can rotate the teeth. We're going to show you how to rotate them, and we put a little flexible wire in there to start with, and your teeth can be anywhere you want to, and you put the bracket on the tooth where the bracket and the tooth, everything would line up in here, and the teeth would be just as near perfect as we can get them that way. And we've got ways of expanding this whole thing. I just sent a video out today. A young lady had a terrible malocclusion, and you can look at the difference in the shape of the upper jaw after we got through and when we started. So we knew she was not using her tongue properly. In other words, she wasn't swallowing properly and pushing that tongue out. It makes the arch form. And her tongue was pushing forward, the teeth stuck out. Well, you can go back and look at that video. It's a tough case, and you had to do a lot of things. But look at that, and it'll tell you what we do with a lot of this. All right, now let me go to the other side of the mouth. Now, we started several years back of lowering the bracket on the lower arch on the 6-year molars and the second molar back here by 1/2 a millimeter. And we dropped that line down because the cusp of the upper teeth, when they were biting all the way together, the upper cusp was coming down and touching that slot, the little arm of the bracket where you're tied under it, and that screwed up everything. So we dropped them where they doesn't go. So the cusp on these never do hit the bracket back here. So here's your omega, and this is just a round wire, but you can do a lot of work with it. Now we'll get on with something else. This just is a magnified method of, showing you what it is. You can put this on a screen as big as the side of a car if you want to. And if you have a hard time seeing some of this stuff. Now, I put this like I'm going to tighten the arch wire on this area right here. I tighten one of them or just put it on and have it passively, but it can't go back in the other direction. Then we go on the other side of the mouth, and we've got one coming up like this, and we'll tighten it. Now the instrument I showed you is something like that, and you push it, and you can pull this in there, and this is a 012 soft stainless steel wire, and I can put so much pressure on there I can pull that wire in two if I wanted to, but we just put enough pressure and it will pull that tight. So you got to have one side tied down, and then you just tighten it from the other side, and it certainly goes all the way around the arch in there. Now, on the upper brackets, we've got an auxiliary tube right here that we use for lip bumpers, intruding arches, and things of that nature. This right here is where your conventional arch wire goes through. Let me erase all that. Your regular arch wire goes through this tube right here. Now, if I have to band this one back here, it may be off to one side or the other. In other words, this tooth, if the edges of it are right and the tooth has more slope, then we have to make a bend in this wire like that. And if you have to do that, in other words, if you have to make a bend like that in there, then you can't stick this bend through this tube right here. So we have a little gadget that you strip this off, just like the your bracket would be like this. Well, let's see. That's not good. It would be this way here, and this cover on the top would be over here. And you stick something under there, kind of like opening a can opener, and you can peel this off. And now this makes a bracket instead of a tube. So when you come in here, you can bend a wire back here and go in and touch that. And you can put it there and you tie it in good. And that's a convertible tube, is where your regular arch wire goes in here. Now this is for a headgear. It's usually a 045 or something like that, or maybe bigger than that. And you can take a headgear deal. We buy a wire, it's an 040 wire or 036, and we make this large arch wire that goes around the arch, and you can expand anything, walking and breathing that comes in. All you have to do is just widen that thing out. But you've got to put buckle root torque in it, or it'll carry the crowns out like that, and you need the roots to go with the crowns. So you have to put this buckle root torque, and you'll have a wire go back with progressive torque in it, and so the roots go back with the crown when they widen it, and this widens the airway, and that's what we're getting at in most of the cases. So we would use that. Let me erase that now. Now this, you have nothing to pull this tooth up against the other tooth, except you got it. But if you have a gap here, instead of having your tie-back wire go, so you see it going here, coming around, and it's underneath here, and it comes up, and you push on it, this, and tie this wire real tight. Well, if you have a gap back here, you run this wire all the way over here, and come back, and push it, and tie it. So this tooth is tied, so the second molar is tied to your 6-year molar, and then you squeeze this, and that ties the rest of this together where there's just almost no space. Now when we finish the case, we take this off, and there'll be a gap in here, and a little bit here, here, and here. So we put a retainer wire in here that is pulling on this and closes this gap, and it'll close these two gaps as we start out. So that's just something. Now, I realize this will seem extremely complicated to some people, but if you hang in there and kind of do this, these things will happen. You can just do near anything you want to the teeth. It's not limited. It used to be, when I had my teeth straightened, we used a labial-lingual type, and they just little putters just pushed on the teeth. They couldn't do anything if you extracted a tooth. Well, they couldn't bring it together and parallel the roots and close the space. It was just a mess. So they just said that everybody had these teeth and you ought to put them in their mouth, but then they took out the wisdom teeth, and they have to pack up these other teeth to get to it. So we won't harp on that too much. Let's go on to another view here now. This is going the other direction, and this is just the same thing. And if we needed to close this space right here, then this tie-back wire would go back and come under all this stuff, tie it and twist it around this wire up here, and that'll keep this second motor right up against this. And then when you tie this back, it keeps these teeth together, squeeze them together. You don't have to put the little lacing on it. You just tighten that thing up and you can blanch a gap between the teeth up here. Or maybe blanch 2 or 3 of them. We don't want to move the teeth too much, but you can move a 1/2 millimeter, something like that, and close it by just tying the arch wire back. And let's go and get to the next deal here. This is just a real magnified area, and this is where your little instrument comes in here. It comes out this way, comes over here, and you can push in this omega right here and pull on this, and you can tighten that thing so tight it'll blanch the teeth out. You cut this off, tuck it inside so a toothbrush or something can't catch on it and pull it out. Because if that pulls this thing out and it's headed this way, boy, it'll eat your cheek up, So you don't want that thing. Now here we've dropped these brackets down about a 1/2 millimeter so that we don't, if it was sitting up here, the cusp of the upper tooth a lot of times would hit the bracket, and when it does, it messes the whole thing up. It keeps your bite open, it doesn't let it torque properly and all that good stuff. So I just made the brackets. When I order the bands, I tell them I want the bracket a 1/2 millimeter below where they normally bond them on. And then we put these brackets on these teeth. When we set them up, we set them a little lower so that the tooth lines up here with the rest of the teeth, right there. All right, we've gone on here a long way. Now, here is the tying the second motor back. So if you have a problem with this, in other words, have to bend this wire in like that, you have to convert this in here to a tube, to a bracket instead of a tube, because you can't run this deal through there, and you have to bend it before you put it in the mouth. But anyway, we hook it up like that. Now, let's see. All right, this is a good shot of the upper 6-year motor band. Now, if we wear a headgear with, this is, I think, an 045 gap in there, and we use an 040 deal on the headgear, or you can, and it fits in this thing and comes out over here on this end. Or if we use the what we call the Big Daddy arch wire, we can build one that goes in here and then curves in a little bit, goes all the way around the mouth, and you take it and widen it. After you've made it fit, you widen it, put it in there, and I'll tell you, I have never run into a person that we couldn't expand their teeth back in the back. I've had some patients that went into 90 and we were expanding their teeth like that. So it's you can do it. Of course, I think I could expand my own if I really wanted to get in there. Okay, let's take a look at something else here. Okay, here is just about place the bracket on the band, 3/4 of a millimeter. I was saying half a millimeter. Just drop them about 3/4 of a millimeter down, and that keeps these upper cusps from coming in and hitting this bracket. So they hit that, and it's amazing. They'll just either tear it loose or bend it down or something with it, chew it. And so that's, you order the band from whoever you get to make your bands and having the brackets put on there. Get the bracket that much. Now when you come off the second bicuspid, it'll be the same depth like that, and we just kind of keep that going all the way around when you put the brackets on the case. Let's see now. Okay, this is just viewed from that side, same thing. Now, we'll get away from the arch wires, and I'm going to show you a guy that took this course several years ago, started making these things. They call them hug caps. In other words, you can take this right here and snap it over a lingual button, and it'll just cover it, and it leaves the plastic around over the top of the button like that, and it covers them up. You can put those over brackets if you want to, and keep them seeing them very much. So here it is over the bracket on the outside. Just put that little hood cap that holds the wire in the bracket slot, you see, and this bracket will be tilted this way a little bit so that the root is further back, and we have a space in between the bracket. We can stick these hooks in and bend the end up, and you can hook elastics up here and pull them this way, or you can pull them the other way, however you want to do them. And this little hook cap, I don't know that they're on the open market now or not, but they you put them in the places where the wire might be rubbing the person's cheek. Makes it a lot more comfortable to use that. Okay, that's just a close-up. Now that's a actual, this an O-ring put around the tooth like that. Now the other just had a skin over the top of that, and we call it a hood cap there, and that works. Either one of those work in doing the orthodontics. All right, here's two centrals that are squeezed together in too narrow a space. So the space from here and where this lateral would come down to be over here is greater than the size of the teeth is bigger than it would be to measure from here to over to here where this lateral is. And you can't put these teeth in where there's no space. So you either have to advance them forward, you come out this way, or you just spread the whole thing out if you need to. And to put that in the right position there in the mouth. Now, I do not use these springs, but if you get the space big enough, these brackets have a little slot that goes down in here, and you can take this deal here would be out like over here with this hook, and you bring it across and hook it over here, and that makes this little leg of this spring push against this tooth in this direction, and it'll turn that tooth like that. Now you've got to have the opening big enough so the tooth can get in there. So we've expanded that and got the opening bigger. And here we're pushing, and we came over with this and hooked it onto this wire here. And this is pushing on that tooth really hard right there, and it'll take that down. And that's a handy thing to have when you're doing this type of work. All right, let's look at this, the top part, those two central setting out like that. If you line those up, this one would have to go over here, this one would have to go over here, and you'd have to have, if you space going from there to there, and this part of this tooth's going to need to be here and over here. So you have to expand that tooth some way or another. You can go out this way with the whole arch and out this way with it. You can bring it forward if you sunk in up here, but you want to keep it looking good. And that's where you can move those wires wherever you want to. Now here are those springs. Now this arm here was over here, so we bring it over and hook it, and it puts a lot of pressure right in there. We'll straighten that out, straighten this out over here. Now, and then we want to get them lined up, so you're going to have room on there to line the teeth up. Now let's that's another view of these things. All right. Sometimes your cuspids have a more of a expansion in them than laterals do, and the cuspid is out further. And so you want the incisal edge of these teeth to be right in here, and so that's bringing this out, where it will match up with that, and this go back in this area right here. But you may need to adjust this bend in the arch wire so it'll hold it in the place you want it to. And so you can look at it and see, and you can just make this wire, grab it with the band here, bend this with a plier, bend this in a little, and come back up, and I'll bend this down good there, and come on around with it in that fashion. And you see those little openings under that bracket. So those brackets are much more economical than other. What I did wrong here. Now, here's another trick on adult orthodontics. Normally your bracket would be up here somewhere, but you can put the bracket down there, and as you come around to your bicuspids and things, you can raise your arch wire up and just keep the incisal edge at the same time. And these people run around and you don't even see their bottom teeth. You don't see the brackets on the bottom teeth down there. They're kind of hid with this by losing them, moving them that far down. Let's get this over. Now looking at it from here, this is too much. It ought to have a little bit more. However, we got to bring this bracket into this wire. Sometimes we have to use a wire ligature and we push on this and get it down in there where it's like that, and then wire it on where it'll have to stay, and that tooth will shift, and this will shift, and you can get bend into the braces that are in combat and having a tough time. They can take care of them much better. So we'll go to another deal. Now, sometimes the band is really full. Alright, we're going to keep the annotation. So, I'm go ahead and stop this video. We spent about 46 minutes, and that's longer than I had intended to. And I'm going to come on around and stop it at that point.